the number of cases in Qatar may be high, but they're actually mild cases. So 93% of the cases are mild. Only 1% end up in ICU, and another 5% end up admitted in the hospital. And that's actually quite a good rate to have in the country, and that's because we are very active in seeking the cases. We're very active in finding cases, tracing them, isolating them, quarantining them, and therefore managing the case and situation much better. We're a small country, and in all these statistical measures, small countries are disadvantaged because if you look at per population, if you're a small country that tests a lot, and that reports your testing results, then you'll always look like you have more cases than the large countries. Because the large countries will not be able to test per population as much as we are able to test per population. So per population we look like we have more cases. But that doesn't mean they do not have this many cases. It means that they have not reached the level of testing per population. So you'll find countries like Qatar, like Luxembourg, like Iceland have quite a high number per population. But that's only because we're small and we test a lot. We have a very low fatality rate, probably the lowest fatality rate in the world right now. I believe we and Singapore are the only two countries with such a low fatality rate. So we've had so far 12 patients that died, which is if you look at the actual fatality rate, that's 0.74 per 1,000. That's extremely low. First, it's because we track and trace early. So we identify the patients early, and everybody that we identify as positive, we take them through a rigorous health screening. So if you are identified as positive, we will check your blood, we will give you an X-ray, and we will make sure that you stay healthy throughout your isolation period in our facilities. At the minute you deteriorate or we see signs that you are potentially at risk, we will start you on a number of medication protocols. And this way we prevent that you deteriorate to the point of reaching the ICU. And then in the ICU, should you reach the ICU, we have a very, very strong team in the ICU. Our healthcare system is very strong. Thanks to His Highness, who has emphasized over the last few years on building a very strong healthcare system, we have enough resilience in our healthcare system to take a very large load. So we are fine when it comes to the healthcare system. We have actually built up a capacity to have 700 ICU beds, fully equipped with ventilators and fully staffed if need be. One of the things that we've done in Qatar is we've dedicated COVID hospitals. So early on, when we saw that the threat of corona is coming on board, we were very concerned for the well-being of our population. We did not want outbreaks in our hospitals. So we dedicated 5 hospitals, 5 totally new hospitals just for caring for corona patients, so that the general population can continue to access health care in the tertiary hospitals and in the community hospitals. We also have invested in a lot of new innovations. This has created opportunities for the local industries to emerge because, as you know, there is a crisis on masks and accessibility of masks. So now we produce masks locally. We also produce ventilators locally. We also produce some of the protective gear locally. So this has been an opportunity. So the threat has created an opportunity for our local markets. Quite early on, through our tracking and tracing, we identified that there was a cluster in the industrial area. The industrial area is a very important area for us because it's the hub of our business activities and our commercial activities. So it's a very important area for us. And when we identified that cluster, we were concerned that we have a cluster starting in a zone that's quite important. So we took very strong public health measures, including locking down the area, in order to safeguard the well-being of the community that's there. The community is quite large. It's a very large zone. It's a full city in itself. And what we've done is that we have made sure that the community has all its needs in that zone, and that the healthcare professionals, we've set up a number of mobile clinics there. We've set up a number of hospitals in there, a field hospital actually, in order to make sure that all the public health measures and all the medication and treatment that the area needs is contained and is available for them.
But you know, because when you started the locking down that area in particular, that's where international human rights organizations were pretty much concerned, saying that basically the migrant workers are at particular risk of exposure to the coronavirus because of the lack of adequate water, sanitation, and that those areas are notoriously overcrowded.
I think the point about dense population is true everywhere. So in every city where there is dense population, the risk of the coronavirus spreading is higher. So you saw that in the capitals where there's very high dense population, even New York. It's a very densely populated area. So when you have dense populations, then you have a higher risk and you need to take very strong public health measures. And that's what we did. And we have multiple organizations working at making sure that the population in there is active, because they are active, they are still, they're working, they're getting their wages, they're going down, they're shopping, they're moving. So the area is locked down, but it is not restricted movement for the individuals unless they are quarantined themselves because they're suspected, or unless they're isolated themselves because they're positive cases. The new application, احتراز, which we launched recently, and which shows you if you have been in contact with somebody who's positive or in contact with somebody who's quarantined, and then you'll be able to know if you're at risk. And as well as we will be able to identify who has been the contact of an individual. And it's very fruitful. We've seen the early reports of احتراز, and it's really helpful in identifying who has been in contact with who, so that we can isolate the individuals appropriately and quarantine them appropriately if need be, and also, more importantly, actually tell them that you've been in contact with somebody who is positive and that you need to be aware and watch your own symptoms and see, and if there's something that you might be worried about, reach out to our hotline. The new application, احتراز, which we launched recently, and which shows you if you have been in contact with somebody who's positive or in contact with somebody who's quarantined, and then you'll be able to know if you're at risk. And as well as we will be able to identify who has been the contact of an individual. And it's very fruitful. We've seen the early reports of احتراز, and it's really helpful in identifying who has been in contact with who, so that we can isolate the individuals appropriately and quarantine them appropriately if need be, and also, more importantly, actually tell them that you've been in contact with somebody who is positive and that you need to be aware and watch your own symptoms and see, and if there's something that you might be worried about, reach out to our hotline. By putting in place all these social distancing measures, we have actually flattened the curve, but also we will continue to monitor when we've reached the peak and when we've gone down of the peak. So we measure attack rate, so how many people are infected in the population that we test, and we've seen attack rate in general reduce in certain communities. So we're very happy with that reduction. We measure our reproduction rate, and our reproduction rate has dropped significantly, and we're very happy with that. And we need to really continue. So the general community has been fantastic in complying to the guidelines and to the directives of the government around keeping your social distance, staying at home. And because they stayed at home, because the businesses have been consistent at keeping the social distances, masking, we have managed to reduce our attack rate, reduce our reproduction rate, and we will, inshallah, soon see the end of the peak. As a country, the confinement measures we took were quite reasonable. So we did not take any measures that we did not feel scientifically we need to take. So we took the measures that were most critical and high risk for our population. So we will remove these measures in the same way. We will start by removing the measures that are lowest risk for the population, and the ones that are highest risk will be removed at the end. And we will be phasing unlocking of all the measures in place. And we will follow the guidelines, the best practice. So WHO has put out some advice on how do you phase out. And the advice is be very careful, do it in stages, do it between 2 weeks intervals. And that's the principle by which we will be doing ours also. The COVID virus is a new virus that every country is learning how to address. I mean, even the WHO is giving advice as we learn more about the disease. And it is apparent that indeed the COVID virus will be around for 1.5 years, if not 2 years, until there is effective treatment or there is a vaccine. And the two, there is promising work on both areas, treatment and vaccine, but there is not yet a timeline showing when that will happen. So I don't think anyone can foretell the future, but we will have to be, as countries, all countries, Qatar and others, we will have to be very vigilant and keep our public health measures in place, keep some restrictions to ensure that we do not allow resurgence of the diseases. We will have to reinvent the way we work. So this experience has been very positive in Qatar. So the innovation, especially in health, in education, have been quite important. And these innovations will be key to maintaining low infection rates in the next period. Mm-hmm. So more online activities. In the healthcare services, for example, we do a lot of home delivery. We do telemedicine now. Our patients, our elder patients, do not have to come to the hospital. We come to them at home via our teleconferencing facilities with them. They do their physiotherapy with us online. We deliver their medicine at home. We do a lot of our referrals and our consultations virtually now. And these type of innovations in health and education and other sectors will be really important in the next year and a half, because as outbreaks go up and down, these measures become very important, and these innovations will really keep our system. There is a new norm of how to do business now, and that new norm needs to be well understood. So good public health, good hygiene need to mean to people good business. So if as a business, if I have an outbreak in my business, then my business will be impacted, my business will slow down. But if I manage the public health, if I make sure there's social distancing, if I make sure my workers are well protected, they're masked, the public that comes into my organization also is masked, and I took all the measures that I need to take, then my business will not be affected. And if I'm innovative, if I think of how can I deliver my business online, how can I deliver it to people's homes, how can I deliver it in different methods, then I will not be affected by this. So innovation is really key, and I think that's also one of the areas that Qatar is contributing at a global level. So Qatar has participated in the United Nations accelerated labs on innovation to help promote global innovations across the world on how to improve businesses, improve life in the new norm, which is a norm with Corona threatening over our heads.